Launching.
Okay.
Good day, good noon, good afternoon, good morning, good evening, depending on where you are on this pandemic planet. This is Andy Revkin. I run a new initiative at Columbia University's Earth Institute, an initiative on communication and sustainability. I've been a journalist for 35 years, covering risk basically, mostly environmental, occasionally medical, and but nothing on that side close to the expertise and experience of those who you're going to hear from today in this lunchtime for us and dinner time for Kai discussion of headlines and getting behind the headlines. Jeff Schlegelmilch, who's the head of our National Center for Disaster Preparedness at Columbia University, has warned the average person not to try to track every detail of the news. And everyone on this call knows the reason. The news process is always about the new, and the new is usually somewhat tentative or contested, and so we can end up actually amplifying public confusion by paying too much attention to the actual new thing. A special guest today is Kai Kupferschmidt, who's over in Berlin, amazing city. A friend of mine recently did a live broadcast from the Hudson Valley where I live with colleagues in Berlin who study nightingales, the birds that sometimes sing in the evening. He was doing a clarinet concert from the Hudson River Valley with a nightingale at midnight in Berlin. So I'm thinking about Berlin off and on. So we'll start with Kai. You're looking at kind of a collage via Google News of Kai's work. He's been at this a long time. He writes for Science Magazine along with John Cohen here, but also for other publications. So let's just shift gears here to the group setting. And you're going to hear from Wendy Wertheimer, who has decades of experience at both NIH and the World Health Organization on the epidemic frontiers, at how you mesh what we know from science with how we do things on the ground. John Cohen from Science Magazine, and Bob Bazell, a longtime 30-plus year NBC science correspondent who is writing actively now on this issue as well. Laurie Garrett, Pulitzer winner, who's been covering epidemics since before I was a journalist, which means a really long time, is slated to join us as well. But let's start with Kai. You're new to this coffee clutch. And just give a snapshot of your background, your situation in Berlin. You know, Germany has gotten a lot of good kind of press for its response. And then we can start to talk about the week's news and the like.
Right. Thanks for having me, first of all. I've kind of always wanted to be a science journalist. I studied molecular biomedicine at university, knowing I wanted to go into journalism afterwards. And so I basically did a diploma in molecular biomedicine, went to journalism school here in Germany, then started at a Berlin newspaper. And then we had an outbreak of a foodborne illness in 2011 here. It was an E. coli strain, an enterohemorrhagic strain. And it was kind of the biggest foodborne outbreak, the deadliest in Germany since the Second World War. And so I wrote a lot about that, and then Science Magazine kind of asked me to also write about it, and that's how I kind of started to become John Cohen's colleague. And ever since, I've mostly covered infectious diseases. I do other stuff, but a lot of it is infectious disease reporting. And it's interesting to do that now from Berlin, because indeed, Germany has been one of the countries that's kind of been held up in some ways, as an example. And it's an interesting story because we're kind of running into this prevention paradox here now. So because we've done quite well, people feel nothing really happened. And the push to reopen is probably even stronger than in many other places. And so there's a lot of people are worrying that we're just going to end up, instead of becoming the South Korea of Europe, getting hit by a second wave fairly soon, and in the end not having much to show for all the good work that was done in the beginning.
What's your take? The other country that's gotten attention for taking a very different course is Sweden. I've been tracking a lot of the outcomes and issues there. I assume, in Europe, you're paying a lot of attention to that. Is Sweden still getting good press, or it looks like now the rates of disease and fatalities are tweaking in different directions, and then we can broaden this to the others as well.
There was a day last week, I think, when the New York Times ran a story basically saying, what's Sweden doing right? This is amazing. Its numbers per capita are so much lower than like Spain or Italy, in spite of this approach. And the same day, I think CNN or someone else was running a story saying, Sweden is now recognizing how terrible its way is because the numbers are way worse per capita than Denmark or Norway. So you get into this problem very quickly of who you're comparing, what countries you're comparing. I mean, there's a lot of people who have said that the Swedish kind of way of life is naturally a little bit, socially distanced compared to other places that I know. So I find that very hard to judge. I mean, in the end, I think some countries probably did in the lockdown, the way that it was instituted, some countries did a lot of stuff that probably didn't help that much because either you did a lockdown or you didn't. You didn't really know what would be helpful and what wasn't going to be helpful. So I find these examples of countries going different ways, I find them super interesting. I mean, I'm kind of glad I don't really want to live in a country like that, to be honest. I find them super interesting as an almost natural experiment. And I think it's going to take a few weeks or even months to really evaluate, how they do, because it also depends on what happens with the second wave, how people react, when maybe measures are taken after all. Maybe countries that haven't had a lot of measures taken early on are way better at then adhering to them when it really matters. So I think it's too early to really compare these things. I just think, it'll be interesting data. Right at the start of this outbreak, I talked to a modeler in the UK, Stephen Riley, and one of the first things he said to me, which I didn't quite understand at the time, was, this outbreak is going to be fascinating because there's going to be so many counterfactuals. And I'm starting to realize, what he meant by that, there is going to be, reams of data that's going to be analyzed for years about, how did some countries do compared to others.
That's such an interesting point. I'm going to broaden out. Several things you raised, points you raised are really interesting. One is, we're all in a big experiment. Basically, the world is very variegated. This reminds me of the Paris Agreement and climate change. This will sound weird, but the only way to make that agreement work was to acknowledge that there'll be diverse responses. Like Germany has a very different climate policy than even than the United States, absolutely, and other countries. And it's just that's the way the world is. And so here we have these live experiments. The difference is here we're living in them in real time with this fast consequence outcomes potentially if things relax, and the pace of the rebound could be really problematic. So let's do a little bit of a round here. Wendy Wertheimer, again, as I said, a long time, not a journalist, but you've been approaching these issues for decades, from the AIDS pandemic onward. When you hear about the idea that the world is so diverse that Germany is facing a prevention paradox because of its good outcomes so far, what do you start to think about?
I think for me, this week has been almost the worst week so far. I think in terms of information and what you all do, especially, it's kind of been a week of secrecy, of lack of information, perversion of information. And over the last few days, the whole conspiracy theory on multiple levels, and the fact that people don't believe the information, including and don't believe public health authorities. And the White House isn't helping because they're not furthering the public health messages. So I've found it a very disquieting and kind of scary week for that. And I kind of was wondering if the three of you who have covered journalism for a long time, it seems like all the messages are coming from the White House. So the big stories that people hear are being covered by the political reporters. And there aren't the kinds of press conferences we had during Ebola, during AIDS, during Zika, that the information was coming from CDC and NIH, which is where you all thrived and provided the most current information and public health information. Is the fact that this is all being controlled by one place, do you think that's contributing to this politicization of public health information? And I don't know if it's the same thing overseas, Kai. That it's a sort of culture war here of, a mask has become a symbol somehow of, and there's this whole world of people walking around with guns who want to open the economy, who don't believe it's real. They don't believe the death numbers are real. They think that they're blaming hospitals to try and up their Medicare reimbursements by increasing their death rates. That's a jumble of different thoughts, but it's all, to me, just so serious. I mean, there were conspiracy theories about AIDS, but they weren't being made viral, no pun intended, by social media. And I feel like we're fighting a war against the virus. We're fighting a war against the White House. We're fighting a war against conspiracy theories. And everybody's going in a million directions and we're not fighting together. That's my uplifting thought for the week.
Yeah, so maybe, John, you're covering this sort of hour by hour, day by day. We talked, I think, last week, if it was just last week, I guess it was, about this almost impossible situation that the media have, because the White House, well, as Jay Rosen at NYU said on this program, Trump has this unique propaganda style, whether it's intentional or not. And he alluded back to an early advisor of Trump, that you basically flood the zone with crap, using the S word, and then it's this impossible situation where the media we can't not cover it, but then you have ridiculousness that swamps all the actual news and creates this. As Jay Rosen said, this is the biggest propaganda pulse in the history of our country, the modern history of our country, between now and November, because that will. The way the system, the news system, the 24-hour system, we talked with Bob about, CNN really came about as the AIDS epidemic came around. So AIDS came before the real pulse of 24/7, nonstop recycling, eye candy news. So John and maybe then Bob, you want to weigh in on what you're thinking about that a little more in the context of this week?
We've had a challenge from the beginning of the Trump White House about distractions, about things that aren't really news stories that we as journalists have to go chase down because Trump has said this. And it started with his vaccine position right after he came into office, and him questioning, kind of tickling the idea that maybe vaccines are dangerous and flirting with it. And then there are all these journalists chasing the story to prove that vaccines are real. It's just a phenomenal waste of time. I think Kurt Vonnegut called it the grand falloon. And we have all these crazy distractions that I'd rather be doing real journalism. And science, I think, opens up all sorts of opportunities for people who want to gaslight and play with people's minds, because people don't understand fundamental things to begin with. I saw Anderson Cooper last night interviewing someone who had received one of the first COVID-19 vaccines. And he was saying to this guy, you're so brave for doing this. You're so courageous and are you getting the live virus? And Anderson Cooper didn't understand the fundamental concept of a vaccine, that it's not the virus itself, that it's a safe, modified version of the virus. And he's a very smart person. And so it just kind of clued me into this notion that there's a great deal of confusion, and the Trump administration, I think, takes advantage of the low level of scientific literacy that exists anyway. So if he talks about drinking bleach, or some other whack, whatever it is, people are there are a certain segment of the population going, well, they're listening to it. They're actually paying attention to it. Where those of us who know something about science are just going, we're face planting, we're doing the Fauci face plant. Are you kidding? Or we're doing the Debbie Birch eye roll, So there's that, and I try not to pay a tremendous amount of attention to traffic and clicks on our stories, but I do. I admit that I look at it and I like to see when I have a story. Kai does too. He's got to admit it. You want to know if we're being read. And the other day I had a story come out. You might remember last week I was optimistic about monoclonal antibodies. And my story came out. I've been working on for a very long time about monoclonal antibodies. I'm really proud of the story. And I go to look on our traffic and I see that it's being eclipsed by all these stories that I wrote years ago about Judy Mikovits. And I don't know what's going on. Like, why are people reading my stories from 2011 and 2012 when I just had this current monoclonal antibody story come up that's important? And that stuff is ancient history. And then I realized that she's taken over the conversation with her theories that are groundless, that are distractions. And there's this vacuum that she's filling. She's feeding people's desire for certainty when there is no certainty about these things. And it creates opportunities, I think, to essentially be parasitic and corrupt science.
Now, let me share one good news headline, and then Bob, you can weigh in. If this is true, of course. Let's see if it's true. See if you think it's true. The Washington Post had this piece showing that while we in the media pay a lot of attention to outliers, you know, the guys with the guns storming the Michigan state capitol, or these memes that float around, or rebutting outlier positions, that Americans mostly seem to be, according to this piece, actually doing the right thing, you know, on average, and believing the right thing, or knowing what's not true. I don't know how that feels. Does this, obviously you have to read the story if you haven't read it to get the full dimensions of this. But there's been other stuff I've seen too that says, you know, basically Americans are supporting shelter in place. They are not, you know, buying some of these ridiculous solutions, quick fixes. So, Bob, could you give some sense of your thinking on this right now?
I think a lot of Americans do have a sense of what the uncertainty, and this is a week when I think a lot of moods change, and I'm certainly not basing this on polls, but just talking to people around the country and my friends. And what's set in is just how long this is going to be going on. And we're not just talking about second and third wave, we're talking about this, barring some miraculous, or not miraculous, but barring some truly effective treatment and or the way off vaccine, this is going to be such a long haul. And there's been, and I think we spend too much time talking about Trump. I mean, Trump is clownish to us. He has done some absolutely horrible, inexcusable things. He's been the opposite of a leader. He's been the opposite of somebody supporting science or public health. But he's not the only one. We have a lot of governors in the United States, and this is a giant computer. A lot of people giving advice to people. And some people are chafing at the bit and even rioting to get back to work. Others are terrified at the prospect. And there's no way to give a message that's equally reassuring to both those groups, because the science is just so much in its infancy. And nobody is capable of doing it. And so it's a very disquieting time. And I think particularly, if you walk around here in New York, and I'm sure this is true in other big cities as well, you get a sense of how much life will never be what it was before. There'll be a life, human beings will live here, but it's such a dystopian feel to it. When I talk to people who are lucky enough to stay in their country houses, they don't feel so bad because their country houses look like their country houses are supposed to look. They're in the country. And it's getting to be May, and things are booming, and it feels pretty good to be out there. You know, you can't see your friends as often as you want to. But in the city, it's an enormously depressing feeling of an inevitable bad change that's going to go on for a long time. And a lot of it has to do with, there's going to be a huge, I did a piece this week about risk communication, using Peter Sandman and Judy Lanier as my experts, and they were talking. There is so much outrage in this country, and even though some of the outrage is contradictory, it's going to be persistent outrage, in their opinion. Outrage that we closed down too quickly, or that we closed down because the government screwed up at the beginning, and there were places that didn't need to close down so quickly because they still had a single case, and there was no reason. I mean, and there's very few people in any of these jurisdictions who are doing a good job of explaining to people why they're asking them to do the things they're asking them to do.
So let's circle back to Kai and the situation in Germany. What's your sense of that? That you laid out that prevention paradox. That idea that is and some of this gets to culture. In looking and talking to other people the last few weeks, including for this webcast, it's because you look at Korea and Taiwan, and folks cite their success, and I do try to mention they also are both on a wartime footing, basically 24 hours a day, every year of the decade of the century, so that they have more responsiveness, more capacity to deal with it. And in Germany, maybe is the Gestalt, to use a German word, distinct from that in the United States, or what's your sense of this? And do people get the long haul part of this yet, from your standpoint, Kai?
I mean, you'll know this better than anyone. I mean, people, we're just ill-equipped to deal with long-term, changes that are inevitable and foreseeable, but aren't there yet. So no, I don't think that's quite sunken in yet either. Germany is interesting. Like, we have some stuff that reminds me a lot of the US, and then some stuff that's really different, right? I mean, just to address the misinformation for a second, and I've discussed this with Jay Rosen and others. I mean, in Germany, so when we do the big press conferences of the government, we have the house of the Bundespressekonferenz, which is like the federal press conference. And that's literally, a group of journalists that cover politics, and they invite the politicians to come to their place, and they are the ones who lead the press conference. They are the ones who decide who gets called up next in the press conference to ask the next question. So sometimes John convinces me to watch some of these White House pressers. I really try to avoid it, but he's like, Kai, you have to watch this. And, it's usually late in the day, and I've had enough bad news for one day. But, what really gets me about these is the way that Trump kind of turns the journalists into props, and the way that he gets to say, oh, I'm not going to answer this one. What a stupid question. Next. Like, that's just, it's just by design such a weak position for the journalist who's supposed to hold power to account. I mean, how are you going to do that in that situation? Yeah. So that's just a very simple, basic thing that is structurally different in Germany, and I think that changes a lot of things. But apart from that, we do have the similar situation that Merkel doesn't get to decide, what opens when, because we have 16 states, and the heads of each state decide. And you get this kind of similar dynamic that you maybe have in the US, where some states want to, push forward. And then, so some people actually said that during the lockdown, it might have been favorable, because when some states started to do the lockdown, others felt kind of inclined to also do something. So it kind of became a race to lock down the country. And we ended up doing it fairly early in terms of the numbers we had, partly because we were testing a lot. We had a lot of mild cases. So while the number of cases was high, the number of deaths was still very low. So that happened quite early, but now we're getting this opposite dynamic with some countries, some states starting to open up, and then the rest also kind of being like, the businesses saying, well, if they're allowed to open up next door, why aren't we allowed to open up?
Right.
So it's complicated. What I find impressive at the moment, honestly, in Germany is that there's still there's this consensus that you do listen in general to scientific expertise. Like, there's no, I mean, that's just a basic consensus, I think, across most parties except the extremes. And that the problem with that is that since science is so diverse, you can always cherry pick the scientists that you're championing. You can always find a scientist who's saying, we should open up sooner. So this is why in Germany a few weeks ago, the big science institutions all got together and released kind of a consensus statement. So Max Planck, Helmholtz, Leibniz, they all got together and had a consensus statement of how they see the situation at the moment. because that makes it much harder for the government to say they're following scientific advice when they're really just following one scientist's advice, and you can find a scientist who thinks climate change is bogus, right?
Right. And have you looked at that recommendation, and do you think it's sensible, just from your journalistic standpoint? Did they get it right? Sometimes there's also this phenomenon called scientism, where scientists say, we know best, but they're not really integrating the social, political, economic dimensions.
No, and they didn't. But what they did do was kind of very early on in the document say, this is just us talking about the epidemiological situation and what that kind of would warrant. And we recognize that there's sociological factors, economic factors that also need to be taken into consideration by politicians. I thought that was a smart way to do it, because I mean, in my experience, if you get people from different disciplines together, it's going to take you half a year just to agree on the terms that you're all using. So, at this point, when things have to move fast, it might be good for the people who can talk to each other and understand each other to get together, present their consensus, and let the politicians sort out how important it is compared to the other positions.
So I'd love to, if you could kind of converse a bit now. I don't want to be the only person asking questions. So, John and Wendy and Bob. And by the way, Laurie, I guess I sent her a fresh query with the link. She may have missed.
Yeah, she's trying to log in. There's something that happened this last week that was notable in terms of White House press conferences. They stopped. I mean, we switched now to a press secretary who is, packaging the information, and they've lost their luster. Yes, the crazy is gone, but they're no longer gripping TV. It's no longer the spectacle that it was, and the White House has calmed things down. The temperature has dropped, and they've basically put not a face mask on Trump, they put a muzzle on him, and he's not the star of the show anymore, and that's a big shift.
Or did he put a muzzle on himself because the polls showed that he was doing so badly with that daily performance that it was actually hurting him? But I'll get back to the real decisions now. I think from the beginning of COVID, it's very clear that Trump has no idea what to do with the public health situation, and that people are turning elsewhere for information, mostly states. And some state governors in the United States have done well. Cuomo did badly for a little while, and now he has changed to being an example of one of the best, and people from all over the country tune in to listen to his daily briefing even more than almost any others. And other governors are held up as having done as good as you can in the situation. But still, I get back to this. We're in a state of great despair and anxiety and anger. That is just we were already before COVID came in for a lot of other reasons. And this is just another match under that can of gasoline.
Well, there's the fatigue too, Bob, right? I mean, people are exhausted.
Yeah, well, absolutely. Absolutely. And that it's not just the fatigue with the journalists running out of things to say that aren't just a molecular, a big argument about whether there was a new strain, which seems to have been wrong. But what we have to wait to see which monoclonal works and which doesn't, and which vaccine gets furthest along, that sort of thing. And it's just a question of that. And then people have to make individual decisions all over the country, and people make their individual decisions. I'm sure there'll be an enormous amount of research opportunities for this, but right now, some people visit relatives and others don't. Some people will go to the store and others don't. And of course, it's very different here in New York, where almost everybody knows somebody who has been infected. Now, I mentioned before to my friends on this call that my son-in-law got infected, and he's a lawyer with Brooklyn Legal Aid. He certainly got it from Rikers Island. And then his paralegal got infected. The paralegal's husband died. And so it's been that kind of story is not uncommon to many families throughout New York. And that's not the case in Iowa. I mean, it certainly is around meat packing plants and among very poor people, but it's not so many more people in New York, because it's such the epicenter, and the other places that are hotspots have a personal experience. That makes a big difference. So you make a decision. Well, do I go to the store today? How many times do I go to the store? Maybe I could go to a park and sit 6 feet away and have a conversation with a friend and eat a sandwich. I don't know, but people make those calculations, and I'm really interested in how they make those calculations, because it's not as though there's a set of rules the way there is in, say, South Korea. They're very strict and specific.
And Bob, what do you think will happen when we open the economy and businesses say you have to come back to work? That people have high blood pressure, they are, finishing chemotherapy, they've got whatever other kinds of personal health issues, that they don't feel comfortable going back to work, and their employer is going to say, well, if you don't come back to work, we consider you to have quit. You can't get unemployment. But do we need to start looking at kind of accommodation for those people, much as we have for HIV-infected people or other people with disabilities? Companies have to make accommodation to let people in wheelchairs come to work. Is this a whole new?
We already have that. What is it? The number of close to 110 transit workers here in New York City have died from COVID because they've had to go to work, and a lot of them had diabetes and diabetes or other underlying health conditions. So a lot of people remain being forced to go to work just because they can't get unemployment insurance if they don't. And that's going to go on. Now, whether or not anybody's going to make accommodation for those people, there hasn't been much of it so far. There hasn't been much of it from Amazon across the country. There hasn't been much of it in a lot of other places, or in the meatpacking plants. And that gets back to a huge amount of American tradition of screw you. We don't take care of people. No, it doesn't matter what's going on with you if you can't. It's not society's fault if you have a pre-existing condition. The number of people who don't have access to health care, period, has been a scandal for so long, and will continue to be.
I'm just sending Laurie another link. She's very frustrated. I might have sent her the wrong.
One of the issues that you're raising, Bob, is it was easier to be certain when it was locked down, don't do anything. And this accordion opening up is a very confusing thing. And last weekend, I went to get my mother out of her house, my 90-year-old mother who hasn't been out. And I took her, she lives in LA, and I took her to the beach. We drove out, met my brother. We distanced ourselves. We had sandwiches takeout from a restaurant. All these things I wouldn't have imagined doing a month ago. And it was unbelievably satisfying for her to spend this day with her boys and to get out of the house. And she keeps screaming, look, there are other people out. She didn't even know that people were driving around and in the streets. And I think that's the phase we're in now, which is tremendously confusing. How do you open up the accordion in a safe way? And I don't know the answers. And every day I'm wrestling with it, and with my 3 kids, and with Shannon, with my wife. We don't. One of my kids works at a grocery store, and I told him he had to stop a few months ago. I was too worried about their own safety procedures. And now I'm saying to him, well, maybe, and he's embarrassed that he wasn't helping and working there. And now I'm saying, well, maybe you can work there a little bit. So I think all of us are wrestling with how do we release. It's much easier to be shut down completely because there's no question. But now it's a flood of questions, and I don't know the answers, and I keep getting. And
there's no place you could go. There's not a hotline where you could talk to somebody. You have somebody at the other end of a hotline, but you're not going to get. There would probably be, if you called 3 times, you would probably get 3 answers to the same question.
No, and there's not even an answer. I think there's not even a person. Even if you got someone on the other end of the hotline, I think we just don't know. I mean, that's part of the problem that we're doing so little contact tracing, is that we still don't understand very well. Where the spread is happening. I mean, I would love to, be able to pinpoint a little bit better what you can do safely and what you can't do safely. But for that, you really need to follow up all the contacts of people who've been infected and really understand it. And we just haven't done that. I mean, we can say avoid working in meat processing plants. That's great, but it doesn't really help us kind of organize our daily lives, I think. And that's something I find very frustrating.
I'm glad to see that Laurie got the link. I'm so sorry, Laurie Garrett. The last thing you need is confusion about something like that. And I apologize for not sending it this morning. And it's great that you could join us in process.
I don't know what the conversation has been, but just from the last bit, I'll tell you, I have this weird thing that on Sunday or Saturday night, actually, a columnist from the New York Times, Frank Bruni, wrote a profile of me. And for whatever reason, it's now the most viewed op-ed in recent New York Times history. And I have been deluged. My whole life has been turned upside down by this. And I would say that the emails and LinkedIn posts and Facebook posts and stuff sent to my website fall broadly into, three categories. One is, fan mail kind of, which is great. But a big box is the angst that you guys are expressing. It's, can't you tell us some way that we can have a life? I've been hearing from dentists, will I ever be able to reopen my practice? And if so, how will I do dentistry? Tell me the procedures I should follow. Like, I'm going to know. I've been from optometrists, ophthalmologists, physical therapists, every imaginable medical profession that is not directly engaged in infectious disease control. I'm getting deluged. How can we ever reopen? And I'm hearing from nurses saying, I've been laid off because I'm not in the COVID front. I've lost my job. I can't find work. I'm looking at leaving the entire profession at a time when we have a dire shortage of nurses and doctors and so on. And I'm also getting a lot of messages from people saying, now that I've heard about that French case that was infected way back in mid-December, and possibly cases in the United States in January, I think that when my son was so sick that he almost died in January, it was COVID. How can I find out and get tested? And is my whole family now at risk? And why didn't anybody intervene on our behalf? And then I'm getting another whole category of, you are such an idiot. There is this cure. There is this magical app. There is this super groovy biotech thing that nobody's talking about. Or you haven't heard about this conspiracy theory or that conspiracy theory, blah, 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 blah. So these three broad boxes of kind of public angst are washing over me this week like a giant tsunami. And, I love the praise. I'll take it, after years and years and years of fighting just to earn a dime. It's nice to get some positive feedback, although I want to share it with my wonderful colleagues because you deserve it every bit as much. But what's really troubling to me is that, as Bob said, there's no magic phone number anybody can call. There's nobody out there, and your local health department is totally overwhelmed. They may not even answer the phone. So if you're a dentist and you want to know, should I lay off all my lab techs, my oral hygienists, and assume that I'll never be able to afford to reopen my dental practice? Or is this a short-term furlough? And if it is a short-term furlough, what does it look like to do dentistry in the age of COVID? Will my patients ever trust to remove their masks and let me get into their mouth again? And
one of the things, Laurie, that we're lacking is basic, decent risk communication, which is where Andy started with his institute and in a lot of issues, and it's certainly a crisis in risk communication. And one of the first principles of it is to stand up and acknowledge uncertainty, and not to be ashamed of uncertainty, and to say, today, May 8th at noon Eastern Time, 12:40 Eastern Time, this is what we know. This could change in the next few minutes, hours, or days. We'll be here to let you know if it does change, and to keep saying it, and admit we've made mistakes, we're doing our best. It's astounding how reassuring that can be to the public if it's done properly. But we've seen so little of it. And to get back to it again, it's not just the Trump show. Nobody was surprised by the Trump show. It had been going on in more or less the same fashion for 3.5 years. But there is still no, or you probably can find some good examples of it in some small states or something. But there's very little of that where people are saying, I'm in charge here, but I really don't have all the answers. I'm as scared as you are. I understand that we're all scared, and as soon as we can look it out, we'll look it out. I think that would go a long way, not to answering the questions, Laurie, that they're getting asked, but to making people so much less anxious about it. The truth, there's not some infallible person out there who does have it.
Well, and by the way,
But the question is, where the hell is the CDC? I mean, well, let's go back. Let's do the Wayback Machine. Let's do the Wayback Machine a minute, because we all started off, with the baseline of HIV years, right? And one of the heroes of the early days of the HIV fight was Jim Curran, at a time when his own president wanted mum's the word, and certainly nothing about heterosexuals possibly getting infected. This had to only be about homosexuals and Haitians, the two big categories, remember? And yet there was a courageous Jim Curran inside the CDC, day in and day out, feeding information to the media, day in and day out, going through the nuances that you're describing, what we know and what we don't know. Where is the uncertainty? Where is the certainty? We don't have anything like that right now. I mean, can you guys, I was trying to think of a single serious outbreak of the last 20 years where the CDC was not holding daily briefings. Can anybody remember one?
No, this is the first time that the CDC has been cut off. Well, one is because of the current director of the CDC, as some of you have pointed out, Robert Redfield is a sort of weak person, and because the Trump administration wanted to take it away. But also, one of the things to remember about it, and I don't want to make this just about HIV, again, this week, because we talked about it last week so much, but James Mason was the director of this. The man named James Mason was the director of the CDC when Jim Curran was head of the sexually transmitted disease unit, which became the AIDS unit, and became the HIV/AIDS unit. And I know that Mason's personal viewpoints were that he found homosexuality abhorrent, but he did never, in the slightest way, interfered with Jim Curran or Harold Jaffe or all the other people that were working there, with their ability to say the truth as they know it and to admit their uncertainty. And that kind of courage just didn't exist. But now there's this order from the top that this great area of expertise, that probably the most magnificent public health organization in the world, has been muzzled. And it's a really terrible situation. But I get back to that. We need somebody, whether it's the CDC or a governor, and Cuomo has been doing some of this, saying, I wish I could tell you why. I can't. It's terrible. I feel terrible. All these people are being hospitalized. All these people are dying. It's not going down as fast as we hoped or some people predicted. It's just not how it's happening. I don't know why. I'm going to be here every day to talk to you about it.
There's a couple of other factors I want to introduce. One is that, of course, this is simultaneously an economic crisis. So the messaging is not just CDC. My wife, who's a village trustee in a village of 600 people, was just on a 2-hour conference call about what to do about phases of restarting, and listening, just as Laurie was listening, to tortured business owners who are similarly dying, meaning as a business. And that urgency is just as much there as so it's not, this goes way beyond medical and healthcare and public policy, public health advice. And to me, when you think about the complexity there, you think about the limited capacity of you, Laurie Garrett, or us even as the media, and of agencies as well, as Laurie pointed out in a piece in the Lancet a month ago, 2 months ago, about the underinvestment in communication capacity, it feels like a lot of this can devolve toward, well, what else is a distributed entity that has expertise in political science, social economics, public health? It's the university system. It's the body of entities around us, thousands across the United States, who can play a bigger role in being that public portal and in facilitating conversations. You know, what we're trying to do with this Earth Institute webcast in a tiny way is to facilitate clarity conversations around issues where the clarity is about what's unclear. You know, why am I not writing stories right now? It's because I think there's limited utility in writing stories. I was thinking that even in my journalism at the New York Times when I created .earth, it wasn't stories. It wasn't me saying, this is what we know today. It was, we don't know. It's about navigating. So how much of this feels like it might be a time for the media more generally, or us, anyone with a foot in academia, to be thinking about literally a different model for how it's not just like telling the story. There has to be something else that goes on to get that community responsiveness and plasticity. I don't know. What do you think?
I think there's something that Kai can add to this from his perspective with Merkel, because he does have a leader who speaks the ways that Bob was describing.
Yeah.
And also the CDC, just for the facts here and history, it was doing daily press conferences until February 25th. And there was, as you say, an economic link made. And that economic link terrified the White House because we were told by Nancy Messonnier on the 25th that this was going to be severe. And it was a message the Trump White House didn't want to hear because the stock market crashed. And so they held a second press conference with another CDC official who promised us radical transparency, which is Orwellian because there's radical opacity. And Kai, I think you have a completely different experience with leadership.
No, it's true. I mean, so obviously, first of all, Merkel understands the nature of science, which I think, you know, apart from however you end up communicating it, you know, that's the first step. I mean, there's a lot of leaders around the world who don't quite understand, I think, this kind of, you know, constant updating of knowledge. And she does, and she actually even explains it, you know, to political journalists. And she kind of, you know, she grasps all of these concepts and she explains all of it. But I think you also see the limits of that, because that alone also doesn't change things, because you still have, you know, media misrepresenting it. You still have, you know, people making the decisions in the German system who maybe disagree with her, you know, but can open up their state sooner. So I think it's really, while it's really nice to have someone like her, but I sometimes feel like it's more of a, you know, for a lot of us, it just feels good to see someone at the top of the government who understands this and can communicate it well. But, you know, the truth of it is that even the leader of, you know, a country doesn't communicate directly to all its citizens. You know, Trump probably does that more actually than most people in a, you know, disastrous fashion. But we don't have that so much. So, I mean, whenever we talk about this media ecosystem that we're all a part of, you know, I'm starting to realize in this particular situation that we keep telling people now, you know, wear a mask to protect other people. You know, it's your personal responsibility as well. If you have symptoms, stay home. And to a certain extent, it feels like we need to also tell people much more often, you know, you are part of the problem spreading misinformation. Don't just, you know, forward a link that you find interesting if you have no idea of knowing whether it's complete nonsense or not. I mean, I was quite shocked a few days ago when there was a fake news article about you know, that basically said that that the first volunteer who got the Oxford vaccine, I think, had died. She was a scientist. It was complete nonsense, and there were a lot of stories afterwards, you know, asking her how she felt about, you know, all these stories circulating about her having died. But it showed up in my timeline on Twitter. And I follow almost exclusively scientists, and it showed up in my timeline from some scientists and people who really should know better. And if you call them out, they say, oh, sorry, I just saw it. It seemed interesting. I just retweeted it. It's like, if you don't have the time to read whatever you're tweeting, then just, you know, just don't tweet it. And that's something that we need to make way clearer to people. They have to, you know, they should all, we all have to kind of practice hand hygiene and personal hygiene, but we all have to practice information hygiene as well if we want the whole world to not be clogged up with this mess,
love
basically.
that phrase, information hygiene.
Yeah.
Hi, that's brilliant.
Wash your hands.
Well, I'm sure Trump can use it in a really negative way.
Yeah, well, Mr. Orwell.
Wash your facts with bleach. Yeah.
Yeah, don't tell Xi Jinping because he's been practicing information hygiene for a long time.
Yeah.
That's a wonderful way of thinking about it. Really.
I'll get back to it again. In the United States, and it's not all Trump, and Trump can suck the energy out of a lot of things, but it is the responsibility of public health officials as well as doctors and journalists to admit to uncertainty and to constantly be talking about it. Because I think, in my thinking about this just in this last week, I think that it's certainly not going to solve anything. But if we all admit to it and emphasize it, it calms people down. You know, we are all feeling it. I'm scared to death a lot of the time. Not personally, although when my son-in-law had it, I had those kind of fears. But more that the future of my children and grandchildren and what is facing is so going to be so radically different from what we thought it was in January or February, and that's something that we're all dealing with. I mean, obviously, some people are going to be impacted more, but for everybody, it's going to be very, very different.
I've pulled up a paper a commentary from Science that just came out yesterday that I found really interesting. I want to take this in a direction towards solutions again, as I try to do every day. And it's kind of hard, of course, especially with the deep uncertainty in so many levels and the complexity. But this paper, and I'm hoping to do a session on this, was about another dimension, another layer of what Bob talked about a few minutes ago, which was that, well, you all were talking about who do you call? And the National Academies, National Academy of Sciences, yesterday I was on a call because I'm on a committee there on climate communication, where we were discussing the Academy now has a standing committee that's at the beck and call of the president or Congress. And it feels like that model where there's sort of an iterative live discussion as opposed to waiting for a big report or the like to come out feels pretty useful. It's not the be all and end all. You still have to step back and synthesize and come up with a new plan. And this paper is about, I want to get at this idea of the news process. We, as we did a lot with the IHME model and the of course, the Imperial College model, which has been devastatingly scrubbed in recent weeks. We don't really say this. I years ago, thinking about climate science and reporting, I started posting this little warning note like on social media, single study syndrome, caution. In other words, don't pay attention to a single study. And the paper, the idea behind this paper is to look at groups of models, not to make sure we're not, the model of the day can be very dangerous and actually can get us off of good solutions. So I think we need a new tag, call it single model syndrome. And I don't know, at that level, you all are mainly writing for the general public, but you're also paying attention to how decision makers decide too. Is there a story here almost to write about these new, if you have a situation with enduring deep complexity and uncertainty and peril, what do you need? What does that decision structure have to look like that's different than the way we used to make decisions?
I like where you're going with this. I have to say that it's striking to me that there are 3 or 4 teams that are dominating the discussion in public health modeling right now. And everybody sort of imagines that these are the models that the non-public health world are paying attention to. But I'm in a lot of proprietary meetings where I'm hearing the models that Wall Street's following. And I'm hearing the models that the World Bank and the IMF are using, and they're completely different. I mean, they really, really are different. Their set of assumptions going in are different. Their set of assumptions about social behavior are completely different. And then their long term forecasts are different. So, um, I think the problem with modeling, not just the old statistics problem, garbage in, garbage out,
Right.
but I think it's even more than that. It's the bias that you bring as a profession that tilts what exactly are you trying to answer? So, I mean, a public health model is trying to answer some epidemiological questions. What's the trend of infection? What's the prevalence, the incidence, the case fatality rate, these sorts of things. But if you're at the World Bank or the IMF right now, what you want to answer is how does disease trend correlate with economic catastrophe? And what are the what's going to be the rate of failed states? I was in a meeting yesterday where they're predicting 30 nations will go into complete failed state status before this time next year. 30 nations. In other words, they will totally collapse. Um, and where I'm listening to people putting out models saying how this is why this is the worst catastrophe in 400 years. One modeler was showing this is the worst catastrophe since the 14th century. Now, I think I think the problem with the modeling is, first of all, the public doesn't get all the caveats. They don't know why one modeling group at the University of Washington has a different answer from a group at MIT or what have you. And so we are put in the position of trying to explain a model um, without taking people down the rabbit hole of all the data points that were put in, right? But the other thing is, the public has their own biases, just as the modelers do, about what it is they really want an answer to. I think most people want an answer: when can I get out of my house? When can I earn money again? When can I go hug my mother? And none of the models can answer those questions, right? It's a total disconnect. And I'm not sure, therefore, what any of us should be leaning on from the scientific community as a database to guide how we try to go towards those questions for our followers.
To get back to the comparison of the models in the National Academies, the National Academies Committee, which is led by Harvey Feinberg, uh, former provost of Harvard, answers very specific questions that are put to it by the president's science advisor. Other people can put questions to the science advisor, but he sends them on. And the questions are not when can I go out of my house, because obviously it would be impossible to answer that. The questions are, what's the best evidence for how long the virus can live on a ceramic surface? And that's an actual one that they answer. And it's questions at that kind of granular level which if you do it yourself and try to find it in the literature, you end up with a gemisch of things, whereas an organization with that kind of clout can call up everybody who might know something about it and pretty quickly come to what most scientists in the upper echelons of the scientific community would consider a decent answer. Is that helpful? Yeah, it is, but it still doesn't tell you whether you can go out of your house. It might, because if there's a lot of
Yeah, I think
linoleum
the
around,
models, I think the
it stays
models
done.
that we're talking about, there's this moment in the history of this short epidemic so far when Trump and Boris Johnson both switched positions based on models. And the two model groups were the University of Washington Chris Murray group and the Imperial College Neil Ferguson group. And subsequently, there's a few other key modelers that have emerged on the public health landscape. And they tend to be turned to by the likes of Governor Cuomo or of Angela Merkel to decide, well, then this intervention will work. Social distancing is or is not working. We've just hit a juncture. Consider this. We've just hit a juncture here in New York, which the governor announced this week, where um, we everything was following very perfectly what the forecasting model showed would be the effect of flattening the curve thanks to social distancing. It was all looking great. And then we stagnated and we hit a prevalence and a death plateau. And when the health departments started really trying to parse out who are the new, what's feeding this, what's the incidence, the new cases, they're startled to discover the new cases are all people who've been in lockdown. How did they get infected? We have no idea. We've now hit this big, like, what? And none of that's in any model. Nobody imagined a model where somehow people who are in lockdown are getting infected. 65% of yesterday's new cases in New York are all people who were obeying lockdown.
There you go.
It's important to point out that the vast majority of them were Black or brown people who were living, for the most part, tighter. They were locked down, but in much tighter quarters. And that has a lot to do with it.
Well, and I guess statistically, if the total if we've sort of burned through the obvious vulnerabilities, if they've already gotten sick, doesn't that mean that whatever is left will be more of these novel cases that probably have some explanation if you do the contact tracing, but we don't have the capacity to do the contact tracing?
I think the models become more complex as epidemics grow. In the earlier phases, you could predict with regular certainty from different models that this was the transmission rate and it was going to blow up. And people who ignored the warnings looked foolish because the models were generally in agreement. But as you get more sophisticated with more data, the questions become subtler, as Laurie's pointing out, and the models become harder for me to pick out the important messages from. And Kai spends a lot of time looking at models too. I don't know if you have that sense, but it was.
No, I think what you're describing is the fact that basically models work well until human beings come into the equation. No, people basically take the doubling number or the doubling time in R, and then they go like, okay, so we expect this to rise exponentially, and that goes on for a while, and then you get this muddled sense of there's policies being implemented, people change their behavior. No model is able to ever, maybe one day, but no model really captures that, and that's a huge problem. And I think I wrote a story about models a few weeks ago, and one of the modelers I talked to, Caitlin Rivers, she's really great, and she said, one of the problems is, exactly like Laurie said, most people don't understand all the caveats that go into that and how really narrow, in a way, the information is you can get from a model. And of course, most people includes most politicians. And I think that's something that we also need to work on. So she was suggesting, I think Johns Hopkins actually wrote a report on this. She said, there should be, similar to the national weather forecasting system or something, there should be something like a national infectious disease forecasting, also to get the scientists used to talking to policymakers, because the policymakers might have different interests and questions, than the scientists. And that communication is also very complicated. So I think, models have usefulness. There's no question about it. But I think partly because we as journalists are really bad at covering models, they tend to be seen as something that they're not, which is predictions. And that's just not what they are.
Wendy, unmute yourself.
Oh, we're sorry.
Muted. You need to be unmuted, Wendy.
Oh my God,
did I ask you a question? Because there was a moment when you were at the Office of AIDS Research, there was a moment, and I can't remember who it was exactly, where there was maybe John remembers, where there was a key modeling study done for Africa that it was like in the maybe mid-90s. It was before we had effective treatment here in the US for HIV. And this was this modeling study that was done of Africa that showed catastrophic outcome of HIV across the African continent and predicted, mass orphaning, militaries would be infected. There would be a collapse of military capacities and so on. Do you remember, was it CSIS? I'm trying to remember who did this study, because it suddenly made everybody in the multilateral sector wake up and go, whoa, this AIDS epidemic is not just about a virus. And I'm trying to, that was a pivotal model. Do you remember what I'm talking about?
Do you remember, John?
Yeah, I remember it, but I can't place it in time. And I remember lots of models with HIV that were wildly wrong too.
Yes.
There was one about China that I think the UNAIDS put out around the year 2000 about the 10 million Chinese. That was just way off. So I mean, over time in the HIV world, I became pretty jaded, or about models. It became really difficult for me to decipher stuff through the lens of models, and I learn from them and I pluck out things. But I feel like I'm at that phase now where I'm having more trouble plucking out the stuff that helps me understand things, and I imagine it's no different for policymakers.
Well, it's a scientist whom I respect a lot, and I think a lot of you know, told me the other day that it's very similar to battle plans for a giant war. They can be as detailed as possible, but the moment the battle starts, you throw the plans out the window. Because as you said, Kai, human beings start to get involved, and it changes every assumption you've made. And I think that's where we are right now with this pandemic, is people who were inside infected each other because they were inside in New York, and they're starting to come to the hospital. And people who might have not come to the hospital with suspect COVID are coming now because they know that the hospitals are totally overwhelmed. And so, but these are not things that a model could have forecast.
I have a question for Wendy, given that we haven't heard much from you and you have a lot of expertise. One of the things that surprises me is I'm not hearing the voice of Congress much here. And I'm curious, just as we say, where's the CDC? Where's Congress?
And similarly, we talked about this last week, where are the activists? And I had a really interesting conversation after we talked last week with Jeff Levy, whom I think you all know. And he said that, because he's now at George Washington School of Public Health, he said part of the problem now is that when AIDS first happened, there was a really well-organized gay movement. There were organizations who could talk to each other. They were able to work together politically. And then when AIDS came along, that kind of got added to the agenda they already had. Whereas we don't have that now. And I think part of what the advocacy community does is bother Congress. And I think that for Congress, there's not that same kind of urgency of their constituents demanding answers, of their medical schools or their universities going to them and saying, what are you doing? You have to help. And plus, I think the fact that they're not there, and that when they are there, Mitch McConnell has them working on judges and not on Corona. I'm with you, John. I don't understand it. And I think they're as confused and as afraid as anyone. There is this, sense that money is going out the door to try to help. But then they're fighting over who gets the money. And rather than a real understanding of the impact of their actions taken as a whole. But
that's interesting.
I agree with you. I think it's, if you're not physically there, you're not having hearings. I don't know how many hearings I went to and participated in at the beginning of AIDS. And, they're not letting Tony Fauci testify at a hearing on coronavirus. So that may be another part of it, John. If the administration isn't letting experts talk to members of Congress, that's inhibiting their flow of information as well.
And we did a story last week that seemed to me to cry out for a congressional response, because the National Institutes of Health cut the funding of a laboratory, that was doing that coronavirus research and had a collaboration with the group in China. And in the past, there would have been a congressional protection of the NIH to say to the White House, you cannot influence a peer-reviewed grant at the NIH. It was just, the crickets were amazing.
Well, what about cutting the money for WHO?
Cutting the money for WHO.
5 years ago, if somebody tried to mess with the WHO money, and there would have been a hue and cry, a call for hearings. It would have been bipartisan. And now it's just nothing. And I'm hearing from people who are on the Senate side working in foreign affairs that they've already started trying to figure out, how will we fund a global vaccination campaign? What should be the role of the United States? And they can't get anybody from the other side of the aisle to even take their phone calls. So,
So, sorry.
it's like a total dysfunctional mess.
Well, but isn't a big part of that mess and congressional inertia about the again, these two categories of people who they're hearing from, the ones who are threatened by illness and the ones who are threatened by economic catastrophe. So it's like the economics. You remember Carville's nostrum about how politics works. It's all the economy's stupid. And if you get outsized attention to those economic impacts, and I think this is not just Republicans across a big chunk of the country outside of the New York, hot zone for this virus, they're seeing the collapse of their main street. They're seeing the collapse of the university system. I just was talking to a community college professor this morning, and they're seeing all that stuff. And that, again, if you've got these two kinds of constituents ringing your door or tweeting or emailing you, it makes this a lot harder.
Yeah, but it's the virus, stupid.
Well, I know, but HIV, for all the calamity it extracted on our society, didn't create a simultaneous depression, and it's
Right.
so it's really a multimodal system that we're facing now. There, on the solution side, there's this other thing that got my attention. The Atlantic Council has this geotech center, and they put out this report. This gets at the idea of getting past modeling, and I think, Kai, you were kind of getting at this. So let me just show you. I just tweeted this, and I'm going to do another session on this for sure. It's an immune system for the planet, essentially, where, given our capacity to monitor in real time both information and some actual characteristics of flows of things, can we build an immune system for the planet, sort of the same way we do with a human system? And it's essentially a technology-based way of tracking for, like a week ago in this, I did a whole session on wastewater monitoring as a way to do wide-scale, community-scale tracking for hotspots of the virus outbreaks. If you integrate that.
Nothing new here. This has been proposed, all of these features,
Yeah.
many times. And many times I've been in meetings where it's like we should do microbiome, metagenomic surveys of wastewater and sewer systems. We should have expanded zoonotic transmission coordination between veterinarians and public health.
For
Blah,
sure.
blah, 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 blah. Who the heck wants to fund this? Nobody.
Well, is this
Global
a time or not?
Well, no, not now. Maybe when the dust settles.
Yeah.
At this moment, And I gotta say, most of these features, or a fair number of them, were in the global health security agenda, which was promulgated under the Obama and Merkel joint leadership, and it's basically dead.
Yeah.
And one of the other things that's been a consistent problem with a lot of the rhetoric around this, take the tech out, because everybody gets excited about the tech.
For sure.
Of it. Ooh, groovy, a device, an app.
A fix.
Take
Right.
that stuff out. And one of the consistent problems with it is very few countries are willing to grant outside access to do this kind of analysis of their society. And frankly, at the top of the list opposing outside groups coming in is the United States.
Right.
So, it's the same reason we can't get the Biological Weapons Convention strengthened. It's the same reason all the pharmaceutical interventions and looking for dual use research of concern, why all these efforts collapse. It's all like, you can't come into our pharmaceutical plants. We're not letting you outside come in.
I get frustrated at this as well, just because, on a certain level, like on a basic level, we do know how to build a very basic immune system for the planet, and that's to strengthen primary healthcare across the globe, strengthen diagnostic capacity across the globe. We know these things, but we have an Ebola outbreak in West Africa, and we go over and we build all of these labs that can diagnose Ebola and nothing else, and then we leave and we, either take it with us or we don't. But anyway, it's Ebola. So we are there again and again, and I feel like one of the frustrating thing about the solutions is that we do get to the same conclusions usually. We do know what the solutions are, and the IHR specifically, mandates countries to increase the diagnostic capacity to a certain level, to increase the primary healthcare to a certain level. But we're just not there yet. And as long as we have politicians who kind of, have this kind of nationalist rhetoric, which makes it sound like, why should I care about people dying, in a different country? That's not my job. We need to partner up, like countries that have the capacities need to partner up with countries that don't have the capacity and start just building this bit by bit. I mean, I just get frustrated at these kind of big ideas of, globally, and let's do this. I mean, we can all do our part tomorrow. I mean, it's not that hard. We know what we have to do, exactly. But we haven't done it. In fact, we've consistently made things worse.
And in fact, Wendy, when you were working with Jonathan Mann at WHO, part of the whole initiative in the early days of HIV was, let's set up national plans of action.
Right.
And let's make guidelines of what those plans should include. And then let's send experts over to help countries set these things up. And then let's certify they happen. How successful was that?
We had national plans in all the countries. We also coordinated with the United States always and shared information with them on a daily basis. And I do think it was effective. The other thing, and I again hate to make this all about AIDS again, but the other thing we had with AIDS in the United States, Laurie, I heard you on TV the other night say, where's the strategy? But for AIDS, we had a national AIDS strategy that was put together by every federal agency working together, not the political appointees, the civil servants who work together to have a national AIDS strategy, and all government national AIDS strategy, including international. It involved every federal agency. There's an AIDS office. There was an AIDS office in every federal agency. And we worked with state, we worked with WHO. None of that seems to exist at all today. When I was at NIH, we had an AIDS research strategy, but we also involved the other federal agencies that do research, like the DOD, the VA, the CDC. I mean, there was a research strategy across the government. Again, the coordination within the government and across agencies and across countries is something I just don't see, and I don't know who's calling for it.
Nobody.
I think there's a crystal ball here that allows us to see the future, and it's China. And what we see in China right now is imported cases are their biggest worry. And we all have to think about the day when that's our biggest worry, because that will be us. And we are in this together, and the imported cases will teach us that lesson again and again. We can't go it alone. And so there has to be this global sense of cooperation and collaboration that exceeds what we've done in the past, if only because we're more scared than we were in the past about our collective glue. And I think it will happen as soon as we start feeling the fear of imported cases. And again and again, I can look at China and see what's going to happen tomorrow. And something we've talked about during this conversation that I think needs a fine point on it is this hotline of who do you call? People are calling us. I'm sure everyone here is getting the calls from their friends and relatives. We are hotlines because we happen to invest our time into understanding this, and people don't know where else to turn. And I think we also have to be that hotline for this, I'm going to be goofy about it, but for this reaching out and understanding that we're in this together. And that ultimately China is showing us something that's going to be us if we're lucky. But
I'm curious, John, I mean, both for you and for the others, I mean, when I look at the US at this point, and I think, of a US where the biggest problem is imported cases, which is kind of a good scenario to be in. But with your president and with certain people there, I mean, do you really think the lesson that people will take from that is we're in this together? Like, that sounds incredibly naive to me.
Slam the border down.
Finally, a reason to close the borders. Yeah.
Not anytime soon, because we have a wall mentality in the government. It's thinking that you can build walls and stop things. Yeah. That will change. One of the great things about the United States, one of the things I love about my country is we change our leadership. We have an opportunity, at least, to change our leadership. And
boy.
And we will change
Your
based
words.
on how
Let's see if it happens.
Yeah, I mean, I mean,
Let's
this
see what
man
ends first,
continues
Trump
to
or
poll.
SARS-CoV-2. Yeah.
Yeah, he continues to poll at the same numbers no matter what he says or does. And there's a model for you, a math model, the ongoing base of support for Donald Trump.
the viral population load will change. It will. It will. And that will impact how we see things. The viral population load will change.
But there still will be the health disparities that underlie all the problems we have seem to only be exacerbated by what's going on now. And I think structurally, we have so many problems, whether it's minorities, older people, immigration, people who are living alone, people who are ill. I mean, there's just so many different areas that we haven't addressed. And then you lay on top of that this unbelievable problem. I think it would be nice to think that if one outcome could be that we would start to address some of the underlying structural issues around health disparities, but it hasn't happened this far, so I'm not encouraged.
It's
Well,
one
we're
of the
drawing
things that
toward.
scares me.
Sorry.
No, and one of the things that scares me, I was talking to a friend about vaccines, and he was saying, the good thing is that, we're all in this together. And I just sometimes find the idea, I mean, the moment that there's a vaccine, people talk about it being social, but let's be honest. I mean, at the moment, people might care more than usual about the health of their, grocery, cashier, or their, the people on the train. The moment that people have a vaccine, it's a license to be egotistical again. That's something that like vaccines are such a fascinating, complicated, thing, and that's something that like a country like the US, the way that it's going at the moment, sometimes I look at it and I think, people are just waiting for this vaccine to stop caring again about other people's health. That's one way that you can look at it. It's a very negative one, I grant you, but yeah.
Well, one of the things that's hopeful coming from that is that the way Laurie was talking before about the AIDS movement was able to connect with the gay rights movement that had existed before. There is already a model of health equity that came out of after good drugs were developed for HIV. And I think that model and those people who have experience with that, with pressuring pharmaceutical companies and building alliances across nations, will be able to get reasonably priced vaccine or good treatments. Because that there's an example of the structure exists. And people are talking about it, but there's nothing to do until there's something there distributed.
Yeah, well, we are pretty much at the end of a rich session here. I guess one thing that would be great to think about is when you keep getting these emails and calls from readers and viewers, do what Laurie did. Laurie, when we did that session for journalists with you, journalists who are new to the beat, that you said it was helpful for you to use that video then as something you can basically send to people as you get more calls back from journalism schools and journalists who are new to the beat on some tips on what to do. So these archive videos can be helpful to, I think, to post to your audiences. And also, again, I love the idea of this being a regular Friday review. And a big chunk of what you're saying is a recognition that the news process itself isn't necessarily always a solution to these grand systemic challenges. I want to just show this one thing that keeps coming to mind. My colleague at the National Center for Disaster Preparedness, whose whole life is centered around disaster readiness, he says to the average person, whoops, let me just make sure, here it is. He said this weeks ago in his Facebook feed, and then he allowed me to post it publicly. We had a session on it. His name is Jeff Schlegelmelch. And he basically says, a quick word of advice to folks out there struggling to keep up with all the latest COVID-19 info. Don't try and keep up with it all caps, exclamation point. There's a lot of real-time raw information coming out constantly. The fire hose of information is not actionable. and may even be dangerous. If it becomes worth listening to, the CDC or local officials will update their guidelines. Take some time daily to review the latest information from official sources, CDC, state and local health departments, government officials, who will update on what the science tells us. That should be more than enough to keep you updated. We are all dealing with a tremendous amount of uncertainty. Adding more noise won't add to anything but your anxiety. Use your best judgment with the information available, and for the space in between, find ways to relax, recharge, and if you're able, to help others who may be in need. I think it's a valuable message to everyone to
I wish
to
I
take.
could do that.
Well, I know we're professionally obligated, unfortunately, to be drinking from the fire hose and adding to the fire hose. And I think what I hope is that these weekly sessions with you and others who will come in as the time allows can offer viewers, whether they're students or just citizens or elected officials, even a pathway to understand a little bit more of the dynamics behind the headlines, and that we're all in deep doo-doo, and that we all don't understand. We know that we don't know a hell of a lot of things, including how to carve a pathway forward that limits losses. But we do know some of the general principles that you were all laying out earlier. Having a functional health system that serves all, including the subway workers, including the janitors, who are a critical component of our public health system. That is a key underpinning. And you can list those things. Those are things that can be listed now. They're properties of society that can get us through this. And being able to understand the communication system better is another one. So thank you all for being part of this. I kind of read this boilerplate at the very end, just because why not? Sustain What is a global conversation identifying solutions to the complicated, shape-shifting, and epic challenges of humanity's great acceleration. A prime focus is making sense of and getting the most out of the planet's fast-forward information environment. It's the one Earth system changing faster than the actual environment around us. This webcast is produced by Columbia University's Earth Institute, where I'm building a new initiative on communication and sustainability. The basic principle is, how do you make information matter, including information about uncertainty? For the time being, these sessions will be focused on mitigating the unfolding societal disruption and devastation driven by COVID-19, but we'll dip into lots of other subjects and solutions when the time is right. Just yesterday, we did a big one live from Guatemala, Senegal, Uruguay, and here in New York on the farm food climate and COVID nexus. We'll be doing more. We're going to do a whole series on food, including a live session with some farmers in the coming weeks. So thanks for being part of this, Laurie, Wendy, John, Kai, and Kai, I hope you can come back, and Robert, Bazell. Your insights are invaluable, and the more the better. If we can fit this in, and if it allows you to breathe a little bit and reflect a little bit too, that's awesome. And just to renew your friendships, long distance. So thank you all for being part of this.
Thank you.
Thank you. Miss you guys.
Love you all.